Well, over the history of the program, since it started 40 years ago, and the state, undertook Medicaid, um, it acts like a little Pac-Man in our budget. It eats away at all the funding sources that we otherwise would use for K through 12 funding, for higher education, for the prison system, as the pass back through to local government funds, um, and all the other more vulnerable populations that we care for, such as our mental illness boards, our boards of developmental disabilities, and um, and so and the reason for that is really that within, as government assumes the liability for the health care, the health care costs are rising kind of really unabated over the last 20 years. And it's gotten to a point now where the system is unaffordable for just about everyone, particularly people that have lower incomes, but even for the middle class. The entire system is tremendously expensive, and that is reflected in the state budget as the state assumes those liabilities. And so it's crowded out a lot of the other things that the state would traditionally pay for or traditionally allocate money for. Well, the thing that's concerning to me about it is that the liability that we're incurring is very long-tailed. So the question is not really what happens in the next 5 years. The question is what happens in year 10, what happens in year 15. Once you're locked into the program, and once you sign up, you're locked in. Whether or not, will the federal government basically be able to keep their promise that they've made to us to fund it? I wanted to say is that there's another population that really needs help, and that is not addressed by the federal exchange, but I think is one that, as a General Assembly, we absolutely have to help. And we've heard hours and hours and hours of testimony in Health and Human Services about the impact that Medicaid would have on people who have a mental illness and people who are addicted. Because right now, if you have, for instance, an addiction, and you're either remanded by the court or you want to get help yourself, there's an enormous, basically a huge wait. You can't find access to services. And the reason is because as a state we've underfunded the program. And that's something that absolutely has to be addressed. I anticipate us putting an emphasis on that, trying to focus on helping people who have mental illness and also who have addiction problems.
Okay, so that is an area where you're willing to spend more money is
absolutely. And one of the arguments that has been made for the Medicaid expansion, I think a very good one, is that Medicaid pays for the treatment services and the medication for these individuals. And we need to examine whether or not we do a $4 billion Medicaid expansion to free up that critical $70 million for people who have mental illness and addiction issues, or whether there's a more targeted way that we can help those individuals directly that might be kind of a more efficient use of money and maybe even more beneficial for them as they get treatment. We spend 16% of GDP on healthcare. In Japan spends 7%. And you can make, some people use that to make the argument for a single payer system because they say, look, our current system, this hybrid between private and public is just inefficient. That's why you have the 9% differential or 8% differential. But the other reality, and this is something that I think also needs to be addressed, we need to have a conversation about this as a culture, is the fact that people in Japan are a lot healthier than we are. And maybe you can't spend enough money. Your health may be more determined by how much exercise you get and what you put in, the type of food that you feed yourself, more so than you may not be able to make up for not exercising and having a bad diet. You may not be able to make up for that with even a tremendous amount of spending a tremendous amount on medical costs.